Why would you personally seek professional input or medical care as the priority for you? Would you seek care first because you have, with or without an event, pain that just isn't going away, whether it's pain at rest or with activity or tender to touch? Or would you seek care because instead of having full motion, you just don't quite move the same way, even if you make efforts to stretch or to just let it be for a little while? Or would you seek care because you just don't have the same strength even after exercising for some period of time? I can share that I have observed the pattern that patients seek care most often for pain that is ongoing. And for understandable reasons, pain is an uncomfortable experience and can interfere with what you do, whether it's because you're paying attention to the pain rather than what you do, or because it really does stop you. I can share from experience that when other physical therapists have referred people to me, it's because the patient tells them, I just have this tension, or it just feels like I stretch and I stretch and it's just not getting better, or it feels like it's pulling. And from my own perspective, what really gets my attention or I look for is if there is weakness or imbalance from a side to a side that does not change either with time or that I can change on the spot with hands-on intervention. With only one of those concerns, I still think it's appropriate to give them my point of view and to tell them, or to tell you, if you have something that's a concern. If you have 2 out of those 3 concerns, then it's very likely that you're dealing with a neuromuscular presentation that would respond to dry needling or a similar intervention for short term. If you have all 3 of those concerns, it hurts to touch, it has a motion limit, and it has weakness, then it's a no-brainer. I just have to hit the target, and I expect to see change that same day, and you'd know if the pain goes away along with the change in strength or weakness. But I'd really like for you to consider what it is that leads you to seek care so you can recognize when something is important to you.